We need to have a very honest, private conversation today. It is a conversation that many doctors hesitate to have with their older male patients. And frankly, it is a topic that society often pretends does not exist for men over 50. We are going to talk about intimacy, specifically oral intimacy, and the hidden biological risks that change as we age. For most of our lives, we have been conditioned to believe that oral sex is the safe alternative. We think of it as a low-risk activity, there is no risk of pregnancy, and we assume the risk of disease transmission is significantly lower than other forms of intimacy. You might feel that at this stage of your life, especially if you have a steady partner, you have nothing to worry about. But here is the truth that we need to address to protect your longevity and your vitality. The biology of your body has changed. The immune system you had at 20 is not the same immune system you have now. And the mouth, which we often think of as clean, is actually one of the most complex bacterial environments in the human body. When you combine these factors, a simple act of pleasure can turn into a persistent, confusing, and sometimes dangerous health issue. Today, I am going to walk you through the 5 specific risks of oral intimacy that directly affect men over 50. We will look at why you might be suffering from symptoms that your doctor can't explain, the link between oral health and serious long-term diseases, and most importantly, how to continue enjoying your life and your intimacy safely. This is not about fear. It is about knowledge. The first risk, the ghost infection, bacterial urethritis. Let's start with a scenario that is incredibly common but rarely diagnosed correctly. Imagine you start feeling a stinging sensation when you urinate. Maybe there is a slight itch, or just a general feeling of discomfort in the urethra. Naturally, you get worried. You go to your urologist. They run the standard panel for sexually transmitted diseases, gonorrhea, chlamydia, the usual suspects. And the results come back negative. You are told you are clean, but the symptoms don't go away. You are left frustrated, perhaps taking antibiotics that don't seem to work. Wondering if there is something wrong with your prostate or your bladder? The reality is often much simpler, but it requires understanding the microbiome. The human mouth is home to over 700 different species of bacteria. Most of these are harmless where they belong in the throat. However, bacteria like Streptococcus, which are perfectly normal in the mouth, can be aggressive invaders if they travel down to the urethra during oral sex. The urethra is a delicate environment. It is not designed to handle the heavy bacterial load of the mouth. When these respiratory bacteria colonize the urethra, they cause what we call non-gonococcal urethritis. It is an inflammation caused by bacteria that standard STD tests do not look for. Your body is fighting an infection, but because it is a common bacteria in the wrong place, it flies under the radar. For men over 50, whose localized immunity might be slightly lower, this can turn into a chronic, nagging issue that ruins your quality of life. The second risk, the fungal invasion, candidiasis. Now, we need to talk about balance. As we age, our body chemistry shifts. Many men over 50 manage slightly elevated blood sugar levels, or perhaps pre-diabetes. What you might not know is that sugar is fuel for fungi. This brings us to the second risk, candidiasis, or yeast infections. We often think of this as a female issue, but it is becoming increasingly common in men, transmitted exclusively through oral contact. If your partner has an overgrowth of candida in their mouth, which can happen due to antibiotics, inhalers, or diet, that fungus can be transferred directly to you. The symptoms can be alarming. You might notice redness, a rash, or a white accumulation on the glands. It causes intense itching and burning. Because men are not conditioned to look for fungal infections, they often ignore it or wash it with harsh soaps, which only makes the inflammation worse. In a diabetic or pre-diabetic environment, this fungus thrives, causing skin damage that makes intimacy painful and impossible. It is a cycle of inflammation that starts in the mouth but ends up affecting your most sensitive anatomy. The third risk, the viral switch, herpes simplex. For decades, medical textbooks taught a simple rule: herpes type 1 happens on the mouth cold sores, and herpes type 2 happens on the genitals. We now know that this rule is completely obsolete. The virus does not care about boundaries. One of the most significant risks today is the transmission of herpes type 1 from the mouth to the genitals. You or your partner might have a dormant cold sore virus, something you've had since childhood. You might not even have an active sore present. However, through a process called viral shedding, the virus can still be present on the skin's surface. When this is transmitted to the genital area, it causes a new infection. For a man over 60, dealing with a primary herpes outbreak is physically taxing. It involves painful blisters and nerve pain. But the psychological impact is often heavier. It creates anxiety around intimacy. It is crucial to understand that cold sores are not just a nuisance. They are a transmissible virus that can change location and cause significant distress in your senior years. The fourth risk: the silent reservoir throat STDs. We must also address the classic infections, but with a twist. We tend to think that if our partner has no symptoms, they are healthy. But the throat is a master of disguise. Bacteria like gonorrhea and chlamydia can live in the pharynx, the back of the throat, for months or even years without causing a single symptom. Your partner might feel completely fine. No sore throat, no fever. Yet, the bacteria are there, replicating. When you engage in oral intimacy, you are directly exposed to this silent reservoir. In recent years, we have seen a statistical rise in these infections among the silver demographic people over 50 and 60. Why? Because we stopped using protection. We assume that because pregnancy isn't a risk, barriers aren't needed. But these bacteria are opportunistic. An infection like gonorrhea in the later years can lead to stricture narrowing of the urethra, which complicates urination and requires invasive medical procedures to fix. The fifth risk: the most critical warning, HPV and cancer. Finally, we arrive at the most serious point of our discussion. This is the one that truly impacts longevity. We need to talk about HPV, human papillomavirus, and its link to throat cancer. For a long time, we worried about HPV causing cervical cancer in women, but the landscape has shifted. Today, in the United States, the most common cancer caused by HPV is actually oropharyngeal cancer, cancer of the back of the throat, tonsils, and base of the tongue, and the group most at risk: men. You might contract a high-risk strain of HPV through oral sex in your 40s or 50s, and the virus can remain dormant for decades. It hides deep in the crypts of the tonsils. It doesn't cause a cough. It doesn't cause pain. Often, the first sign is a painless lump on the neck that appears out of nowhere. This is why this conversation is so vital. We often ignore dental checkups or ignore that persistent feeling of something in the throat. Protecting yourself from repeated exposure to higher-risk HPV strains is a key component of cancer prevention for men. How to protect your vitality. I know this sounds heavy. You might be thinking, Susan, are you telling me to stop being intimate? Absolutely not. Intimacy, connection, and pleasure are fundamental pillars of a long, happy life. They release oxytocin, reduce stress, and keep your heart healthy. The goal is not abstinence. The goal is hygiene and awareness. Here is what you can do starting today. First, treat oral hygiene as part of your sexual health routine. Both you and your partner should be diligent about brushing and using mouthwash, not just for fresh breath, but to reduce bacterial load. Second, do not ignore symptoms. If you have burning or itching, tell your doctor specifically that you want to be tested for uroplasma or general bacteria, not just the standard STD. And finally, have the conversation. Open communication with your partner about what is happening in their body, whether it's a cold sore or a dental issue, is the highest form of intimacy. Take care of your body, stay informed, and enjoy your life with confidence. I'll see you in the next video.